hip and knee replacement in general, they're two of the most successful, highest patient satisfaction surgeries in all of medicine. That's why I do them. It's fun to be in clinic and see patients coming back and doing very successful very quickly. And it's been that way for many years. But the big focus now is getting people back to normal activities more quickly, accelerating recovery, and kind of fine-tuning the surgical process to make the outcomes even better. Big advancements even in the past few years are getting people moving more quickly, getting people back to normal activities more quickly. And we'll talk a little bit today about robotics in surgery. That's a big thing in the past few years especially.
What sort of questions do you get from patients coming in to see you prior to surgery?
Yeah, people are generally very nervous about their recovery because a lot of people have had family members who've had a hip replacement 15, 20 years ago, and they saw them spend a week or two in the hospital and then go to a nursing facility afterwards. So I think there's a lot of anxiety about that. And then, like I said, people want to get back to their normal activities and get back to that fairly quickly. So they want to know about that recovery process and how long it'll be until they're back to those things.
And it's not uncommon for you to have somebody ask you, listen, if we get this done now, I can be back out golfing or playing tennis by this date, or baseball, whatever it is.
Yep.
Is there any, I would imagine that the quality of not the work, but of the replacement in themselves, how often does that come up? Will I be able to, am I going to function at 100%, 80%? What's life like after the operation?
Yeah, it's funny you mentioned golfing. That's probably the #1 activity that people want to get back to, and the #1 question I get as far as people asking, when can I do that stuff? And again, the whole point of surgery is to get you back to doing that stuff pain-free. I think with modern day advances in joint replacement, a lot of it is holding people back from getting back to that too quickly because we fix the joint, but it's also a soft tissue procedure where the soft tissue around the joint has to heal. So that's a big thing nowadays, is just kind of holding people back, especially with hip replacements. That hip's a little bit easier to recover from compared to a knee.